Hello, dear neighbors. Aren't we neighbors? Don't we feel that through this physical distancing that we are experiencing these days in so many places in the world, we feel how much we are connected to each other. I'm Jean-Louis Lamboré. I'm a medical doctor by profession. The first time I was confronted with an epidemic, and it was a first also, it was cholera in Kinshasa, 1979. Since then, well, we are faced with a few, in Congo first, at that time Zaire, and then at the World Bank, I was asked to participate in the mobilization of that institution in support of the global response to AIDS. That was 87, 88. Later, I participated in the foundation of UNAIDS and went then to Thailand to open the regional office for UNAIDS. In 2004, I left UNAIDS to found the Constellation. The Constellation is both an organization and network of communities addressing their own challenges, counting on their own resources, and sharing their experience with others. This is the essence of the Constellation. What I'm going to propose to you is to basically do a code check with friends to see whether you individually, you as a family, you as a group, are doing what you can to slow the epidemic, to slow the transmission of the virus, and to reduce its impact on people, on the economy, etc. So, over to the presentation. Let us do our part, and the first part is clearly to see whether put ourselves at the same wavelength on facts. The first fact is very clear. It's becoming, unfortunately, increasingly clear. COVID is not just a seasonal flu. This slide shows here the relative case fatality rates per age for 60 years old, 50 to 59. And you can see that COVID-19 and seasonal flu have very different case fatality rates. A small proportion, but still an important proportion. It is small, it is relatively small, but not all cases require hospital care, but a proportion of it, that is 19% in China, required hospital care for basically breathing problems, most of it. Some of them, 5%, were critical cases. They need a respirator. So roughly 20% of the cases need hospitalization, 80% don't. And out of that, 5% need a respirator. Now, let's just take a look at case fatality rates. Those rates are all over the map. If you look, you read the stuff about it, you will see many case fatality rates are being announced or shared. Well, case fatality rates is the reported deaths divided by the reported cases. So when you look at the denominator, of course, if you start having few tests and you only test the severe cases, then the case fatality rate increases. That's the case in my country, Belgium. When the hospital is totally overwhelmed by cases, then of course the ability to save the patients who need most care is not in place, and deaths occur more. When hospitals lack the key equipment, of course, people die. Now, when the population is old and you look the overall case fatality rate, not by age, then of course the proportion of elderly people or older persons in the community or in the population will increase, then have an impact on the case fatality rate. The reverse is true. Case fatality rate is lower when a lot of people are screened, like in Korea or in Europe, in Germany. When the hospitals manage correctly, the hospitals and the whole healthcare system, I should say, manage the influx of cases, when hospitals have the required equipment and when the population is young. Here's another slide showing very well the case fatality rate, this time by age, and you can see that people in China with age 80 or plus, 80 years or plus, have a case fatality rate of 15%, so 15% chance of dying once infected. But once healthcare systems and health systems, meaning the people, the health services, as well as the authorities, get their act together, then you can see that the case fatality rate goes down over time. This is what you have, for instance, in China over time, after they got the shock of this epidemic or now pandemic in Wuhan, then case fatality rate went down as people organized themselves. This is a famous curve about flattening the curve. People, public health authorities and health authorities, as well as political authorities, public authorities, are very concerned about this curve here, meaning once the virus is left at its own devices, then it spreads very fast at an exponential rate, and the epidemic goes down only when susceptible people are not there anymore or not sufficiently present for the epidemic to continue. This is the scenario that countries want to avoid. Unfortunately, this was not avoided, nor in Spain, nor in Italy, for instance, also not in Wuhan at the first stage, because, and so in those cases, the horizontal line here showing the capacity of the healthcare system is overwhelmed, and then people do not get the adequate care. So the concern and the goal is to reduce the rate at which people are getting infected. And so once that is the case, then the epidemic spreads more over time. It does not mean that you have overall less cases, but the cases of the incidence the incidence is reduced over a period of time, which allows then the healthcare system to deal with the influx of patients that need care. So now, we citizens, what can we do here? Well, experts will say, look, we can do whatever in terms of healthcare system, but at the end of the day, it is the individual behavior and the behavior, whether people behave in an egoistic fashion or in solidarity, that will make the difference. Healthcare systems, healthcare services can inform the people, trace contacts, take care of cases. Governments can inform, put in place regulations and laws, support financially the needy, provide direct services when needed. But all that requires us in the way we change our own behavior in the face of this epidemic. And let's just have here a quick and dirty comparison. I put Belgium there, you can put whatever country you are in. So, and let's look at this combination of Singapore and Thailand. Singapore had immediately a clear factual communication. So immediately, health authorities and government stated to the people, look, we have cases, we are going to trace them and we are going to treat them. So the epidemic was taken seriously early on. No place for complacency at all. Strategic stocks were in place. Why? Because a few years ago, they had the experience of a very deadly virus causing SARS, and so they knew that such a thing was possible. And therefore, they heeded, let's say, that experience and put in place the strategic stocks that were required. Contact tracing was put in place early on. There were enough tests to do it, therefore, people were traced. So if I'm infected, I'm interviewed, and my contacts will be interviewed and checked for coronavirus. And so this is absolutely important, because otherwise, well, you go in the dark, basically. The referral strategy that defines who is going to stay home, that prevents people to flocking waiting rooms of GPs, of health centers, and so that also only the needed cases are going to the hospital, was in place, so people knew whether to stay home or to go, and the intensive care capacity was in place. Let's talk about hygiene measures. Well, hygiene measures are effectively implemented in Asia. And let me make the comment, in Southeast Asia at least, and let me make the comment that several of elements of the culture of Thailand, which I know quite well, is making the population more resilient than others. The fact that they greet using the Y, no touching, the fact that, in fact, if you look, you will see that people in those countries don't do like me, touching their face all the time, rubbing their eyes, maybe even visiting their nose. All that is not very polite. It's never polite, but that unconscious behavior is worked on in the culture in Thailand, and you won't see that around so much as we do in our culture. So you see that our own culture influences a lot whether we can be resilient to this issue or not, to the coronavirus. Now, solidarity is another element. If you people have not, international media have not known even, there was a massive, really very serious flood several years ago in the center of Thailand, including Bangkok. And it did not make the media. Why? Because the solidarity kicked in so much that people got relief from their own people, not only government, but also every single district that was not affected organized itself to support the affected people. And that, of course, makes a very big difference when faced with a pandemic like this one. At the end, I would say that what also is very key, and what I learned in Northern Thailand in the context of the epidemic of AIDS, is this one. You need really a harmony between those three spheres. The personal sphere, individuals in contact with family and community, the sphere of health services and social services, as well as the policy sphere. When these three spheres work hand in hand, in harmony, when there is trust between those various elements of society, then an effective response to a challenge such as AIDS or the COVID-19 or the coronavirus causing COVID-19 is very much possible. So what can we do as citizens? That is now where I will turn my attention to now. Well, we can move from the reaction where we are not too much aware of what we are doing to a response. That is, meaning we are aware of what we are doing, we work on our own behavior change, and we do it. I've learned from Northern Thailand something, that is, you don't change others. The only person you can change is yourself. And so what we are proposing here is a process for doing that. let me preface this by stating what is now obvious, that is, knowledge is not enough to change behavior. So advice from health authorities, advice from public authorities is not enough. You can have the information, the required information, and still do nothing. Or keep with habits that are negative for your health. Look at smoking, for instance. Look at drug use, or look at reckless driving or drunk driving. Everyone knows at this stage that this is dangerous for one's health, but that does not mean that everyone heeds, turns that information in useful and adequate action. So there is a need to move vis-à-vis COVID from scare to care and to adapt social norms so that we basically ensure that we all individually change as well. So the constellation there has some experience. We were founded in 2005 to stimulate and support local response to AIDS. The approach we developed in the case to stimulate and accompany local responses to AIDS spread into 60 countries at least and was implemented by communities to address all kinds of challenges. We walk along communities in the pursuit of their dream and in that process to overcome their challenges. We have an experience, among other things, in the dealing with AIDS, Ebola, and H1N1 epidemic some years ago. So this is the cycle. I won't go into the details, but basically what we offer is a combination of appreciation of strengths. We don't start, of course, we have a clear view of issues, but we start from the standpoint of appreciation of strengths. And we combine this with a process for learning from action. Here we will focus on self-assessment, the practices that we can carry forward as individuals, as families, as local communities, whether at work or in neighborhoods, etc., and the practices and where we are at on a path towards positive natural behavior. So SALT is that mind shift. We just propose to shift, as I said, to move from analyzing problems until we are totally tired to the appreciation of strengths. Once we do that, we are stimulated by the discovery of other people's strengths, and people also, the self-discovery of strengths enables them to mobilize those strengths. We do that through listening and through an attitude of learning. So we are not there in terms of teaching, do this, do that. We are not holding a moralistic approach. Rather, we listen and learn from people's experience. This transforms us, and because we are transformed, we are able to transfer the experience to other communities, other populations. So, SALT enables an approach to disease that is not a war, but rather builds harmony. Harmony because this way of interacting with people enables us to establish relationships with everyone as neighbors, whether they are politicians, doctors, or what. We first appreciate their strengths. And that enables us to work together. It builds trust in people's capacity, we can do it, and we value intrinsic motivation, meaning that we know that deep within us, every single one of us on this earth, we have deep in us a natural altruistic penchant, altruistic tendency, or basically, we are basically altruistic beings. Love is the essence of our being, I would say. So why then a self-assessment? Well, this is to look at the practices that would stop the pandemic and then enable us to respond to that. I'll just let you look a little bit at this This one, meanwhile, I recover my breath, but I don't have it so far. Okay, so this is the path towards natural positive behavior. Let me take, for instance, washing one's hands. Well, I know that I need to wash my hands. But how to wash my hands? Is it enough to just take a few sprinkles of water or what? What is the exact technique to wash my hands so that the coronavirus is gone through the faucet or killed by the soap or some alcoholic, 70% alcohol substance? Well, this is the second. Do I know how to wash my hands? The third one is, okay, I know, but do I do it? Or, yeah, I can say once in a while I do it, when I think of it. But once I don't think of it, I don't do it. Then, yes, I wash my hands systematically. It's hard, but I do it. At the end, well, if I don't wash my hands in various circumstances, which we'll discover later, then I don't feel well. So this is the path from realizing this is important towards natural positive behavior. And so here are self-assessment practices. And for the sake of it, I will share my own. So I wash my own self-assessment. I wash my hands before each meal, after I go out and after toilet. I must say that probably this one here, after I go out, or let's say I move and I get to some place, once I used to, when out of this confinement, but that I did not do. Maybe I will do it once I can move, but that one would still need work. So, but for the rest, I'm quite good at it. I do wash my hands before each meal. After toilet, it's quite obvious and long time. But okay, I would give myself a 4 because I'm not sure about that one. And maybe I may have some things to work on the day we can move. I only touch my face to wash it, meaning I don't touch my face unconsciously. This one requires major work for me. I don't even know how to do it to prevent myself. This I discussed with my wife, and my wife is drawing my attention to it right now, but still needs a lot of work. So between 1 and 2, because I know it's important, I know more or less how to do it, but I'm very far from even, I'm conscious about it. Maybe I could give myself a small 3, saying, once in a while I prevent from touching, but I know I'm not doing it. I regularly clean my workspace, my mobile phone, my ID, my purse. Well, once in a while. I have to confess I don't do it regularly. I should, but I don't. When greeting someone, I avoid physical contact. For me, it's not difficult because I live in Thailand. I've done this. And if we as a society, when we go out of confinement, we say, well, let's be careful. This COVID is still walking around here, or let's have some greeting. I will happily do that. So this is number 4. So that one, I would say 4 to 5. I keep a distance with others of 1.5 meters. Yes, that I've done. I've traveled recently and I was shocked to see people flocking and not at all respecting their distance at check-in counter, but no, I'm not part of that one. I'm very conscious of that 1.5 meters distance. I would give myself a 5 on that. I cough and sneeze in the fold of my arm. Well, no, I still not doing it, I must say. I'm doing it when I think of it, but I don't think of it all the time. So still work. I care for everyone, whether healthy, suspect, or sick. Yeah, but do I still see some fear when coming close to people who are exposed to the virus? Maybe. But I think I'm able to watch that fear and to deal with it. So on that one, I think I can go quite high, 4 or 5. I avoid intergenerational encounters. I would give me, and especially my wife, a number 4, saying we do it systematically. We have no contact, physical contact with our grandchildren, which is a great pain for us. But we are very serious with that. And so we use Skype and Zoom, etc., to check on and WhatsApp, to check on our family, but no physical contact at all. So yes, I act out of care, not out of fear. I touched to that. Yes, I think because I did the effort of looking to the right information, and I'm conscious of elements of fear that still can pop up, so I can look at it. When you look at your fear, well, it goes down. So I would give myself a reasonable high level. I don't know exactly where. I seize the opportunity to check on the quality of my life. This is very important. While we are in confinement, we can say, what needs to change? What needs to change in my personal life? What needs to change in our life in general? When once all this is over, that we hear that the virus, someone has done its job and is going silent, what are we going to do? Rush back to the old days as if nothing had happened, or are we going to change? This one, 3, maybe I don't have a systematic view yet of what I need to put in place when this is over. So this is my self-assessment. And so I gave some actions. This self-assessment is not a survey. This is not for authorities to know what you're doing. It is rather to hold a conversation locally with your friends, with your family, with a group, so that a group through Zoom or through other ways, so that you really check on the various practices that puts you at risk, puts your others at risk, and so that you take action to improve. Self-assessment, you can do it as many times as you want, and so you can check on your progress as you go. So you reflect on priority practice, you decide a target level, and you decide on actions. I would say that I would need to go from touching my face from this terrible situation to discussing further how to make sure, doing this with my wife, and then trying to implement that so that I reach level 4. I'm sure it's not going to be naturally immediately, but I'll do my best not to start rubbing my eyes and other practices that are not that I will not describe here related to my face. So this is it. And so if you want to do it, well, you can you will get a guide for your self-assessment. It will be available one way or another. Inform yourself locally, depending on where you are in the world. And if you can, please do this with a friend, your family, or with your group. If no other place to go, in this case, for sure, I'm sure Dr. Dutta will give you some ways of obtaining the guide for the conversation. Enjoy doing it, and we can stay in touch with the results, and we can then be very happy to share those results with other places of the world. Maybe you will want, once you have the experience, share it also, and we can help you with the facilitation of other conversations once you have done it. But you'll see it's quite simple, and you just can carry it forward in your neck of the woods with your loved ones and with people you're connected to. That's what I hope. So my hope is basically that our competence to deal with COVID spreads faster than the virus. Once that is done, hey, the virus has nowhere to go. That's our hope, that's our dream. And on that, thank you very much.